So, hi everyone. My name's Harry. I'm a fourth year medical student at Lancaster, and this is going to be a talk going through sort of how Lancaster's curriculum is delivered, how PBL works, a bit about myself, and a bit about Lancaster. So, to start with, a bit about me. Like I said, I'm a fourth year medical student at Lancaster Medical School. I'm just coming towards the end of my fourth year now. I'm also Lancaster MedSoc's Widening Participation Officer for 2020. I personally have an interest in emergency medicine, and that's what I'm integrating in next year. I came to medical school straight from my A levels at a sixth form college back home in West Yorkshire, and I gained my place at Lancaster from the reserve list on A level results day. I would just like to say this is quite an informal session, so if anyone's got any comments or anything, feel free to put them in the chat, and I'll try and check that as regularly as I can and sort of take regular pauses. But if there's anything that people want to ask questions about, feel free to just pop it in the chat, and when I come to sort of a break, I'll discuss it. So a bit about Lancaster, in case anyone doesn't know, because Lancaster's not the biggest place. We're basically pretty much in the centre of the UK, in the northwest of England. You can see there on the map, we're about 2 hours from a lot of places, not far from Manchester and Liverpool. And it's quite a successful university. So Lancaster University is, as a whole, rated in a top 10 across 3 different rankings. Lancaster Medical School specifically started in 2006. It was initially an offshoot of Liverpool Medical School, and it's since decoupled from that, and it's sort of gone in its own direction with a different curriculum, but still focused on PBL. So, and Lancaster has currently gone on a bit of a sort of an expansion investment program. So we've increased our intake from 54 a year to 129 places, and are currently awaiting the opening of our new building at the Health Innovation Campus. That was due to open a few months ago, but the pandemic scuppered things there. So there's a very shiny new building, which we've got some nice pictures of, that a lot of people are eagerly waiting to move into. So yeah, Lancaster's really sort of trying to push their expansion. They're trying to move forward and make a sort of more inclusive community in Lancaster for the med students. So a bit about what medical students learn, what is it like being a medical student more generally. So obviously, it's longer duration. It's a 5-year degree compared to the typical 3 years. It's a professional training, so especially at Lancaster, we're under higher expectations. You're expected to behave as a medical student. You're expected to work as a medical student. And as part of that, you're part of a healthcare team. You're treated as a healthcare professional, and you're given more responsibility because of that. The way that we learn is sort of experimental learning. So it's a mixture of learning on campus and learning on placement. And through that placement, you're experiencing things, you're gaining things. And the PBL tries to bring in those things that you normally experience on placement into your teaching as well. And we'll come on to how that works. Medicine's also mastery of a breadth of subjects. It's not just the basic biomedical science that people often think it is. Medicine's a very varied degree with a lot of different things to it, and we'll come on to some of the things that medicine includes later. But it also has different skills and knowledge within it. It's much about your clinical and communication skills as it is about your theoretical knowledge, and that's something that a course like Lancaster, where you get to have a lot of placement thanks to the PBL, is where you really benefit from that. So in this slide, we've just got a bit about how different medical courses are taught for people in case they don't know. So a traditional course is usually based on 2 or 3 years at university for mostly lectures, subject-based taught, and then you go for another few years of clinical placement. And that's sort of the traditional way. It's the way it used to be done, and that's very much different to how we do things at Lancaster now. So Lancaster is a problem-based learning institution. So it's more about self-directed learning in small groups, split into different systems for a more holistic approach. And thanks to the PBL, because we have less time at university, it allows for more time on clinical placement and earlier clinical teaching experience. And then integrated curriculum, which is probably the most common in the UK, is sort of a mixture of the different styles. And I won't be discussing that in this topic. So what do we learn? So as you can see here, medicine encompasses a lot of different things. So the biomedical sciences, like you'd expect, probably make up about 50% of the degree because they are a huge part of it. But like I say, it's only half. there's another half to it, which is a really large subject. So you get aspects of sociology, so things like the sort of how diseases work within society, the social impacts, the different models of how these diseases work, which is really important from a medical perspective to understanding how people end up where they are. And the same with the health psychology. You need to understand why people behave the way they do, because some people would say you could get frustrated and irritated by patients for seeing the same things, or people who sort of in society could be more judged for their illnesses. But if you understand the psychology and sociology behind it, you understand that it's not necessarily that person's fault. You understand so much more, and it makes you a much more well-rounded doctor, and it enables you to treat that patient as more of a person because you understand how they are. We also have aspects of public health, especially for times like this. We can see sort of the huge impact that coronavirus is having. And as doctors, we need to understand what the R value means, what the statistics that are coming out are saying. And that's why we have to have training in that area. We have to understand what all that flood of literature that's coming out about things like that now, what it really means. Because none of us have seen coronavirus before. There's no textbooks that are documenting it. The only thing that we've got is papers and research that's coming out, and that's why we have to have teaching so that we are enabled to work through that. And part of the way that PBL works is giving us articles and resources to work through that tie into the PBL that will be in that format. So we'll get professional articles to read, we'll get journal articles to read, and that then enables us to develop those skills and to understand it, and we can go back and discuss that as a group. Same with the ethics and professionalism. In medicine, you are under a lot of ethical scrutiny. You're expected to behave in a certain way. The GMC have very expecting standards, rightly so. So as a medical student, it's your job over the course of the 5 years to get to grips with what are the expectations of you, what are the professional expectations, what are the rules that will govern you, and how do you work within them. And part of that is through the PBL, part of that is through the clinical placement. And then obviously clinical skills. In Lancaster, we get clinical skills teaching once every week in first year. And what that enables us is to develop those basic skills right at the start of our medical degree, so that then we can move forward into and start clinical placement for 2 days a week in hospital from second year onwards. So already you're getting the opportunity straight at the start of second year to put those skills that you've learned into practice, to develop the ability to examine patients, speak to patients, and all those skills are things that take time and effort to develop. And from my perspective, I think the earlier you can start developing those skills, the easier it is for me personally to develop them. Now, that's not for everyone, and some people don't like doing clinical skills early. They find it scary because at that point, especially in first year at Lancaster, we just learn the normal. We learn the normal anatomy, physiology, and understand how the body systems work. But we're learning the clinical skills alongside that. So we don't actually know any of the diseases at the point that we're learning that. So that's something that some people don't like. And then when you start placing it in second year, you've not really got very much medical knowledge at that point. You've only done 1 year of normal things. It's not expected that you'd have a great clinical knowledge at the start of second year. But some people don't like being put on the spot, being scared, not knowing things. It's just one of the things that for us we have to get used to. And some people like it. Personally, I quite like not knowing things and going and finding it out because it puts it in perspective for me. So then when I come to learn it, I think, oh yeah, I remember that patient, Barbara, she had such and such condition. And then when I come to learn about it 2 months later, I got that picture in my mind. That's what that patient looks like. That's what treatment she was on. That's what happened with her. And then that gives you a person that you can then base that off. Some people like that. Personally, I find that really works for me. Some people hate that. They'd like to go in and have all of the theoretical knowledge in their mind ready to go, so that when they start their placement, they've got that knowledge. It just varies for different people. And then communication skills, arguably one of the most important skills. I'd say that if your communication skills are just as important as your theoretical knowledge, because at the end of the day, you've got to speak to patients, you've got to communicate with other staff. You really need to understand how to communicate with people in a variety of ways. And the PBL allows that, because not only does it allow you to get on placement to practice speaking to patients, it frees up time, so we have communication skills workshops throughout first and second year. And then also you get used to communicating during the PBL sessions. These are small group sessions where you're speaking to your colleagues and you get used to explaining complex medical terms. You get used to explaining things to each other and communicating with your peers. And that's a really useful skill to have. So, and then this just shows that PBL covers all of those things alongside it. So here we have a diagram that sort of shows how you go through the PBL process. So you start with a scenario. So to go through this, you'll be in a group of at most 8 people. The least I've ever had in a PBL group's 3. And as a group, there's always a tutor there to guide you. So you get a scenario, and we're going to go through an example scenario in a minute. And from that scenario, you read through it, you discuss it as a group, you pick out the key bits of information that you think are important. And then at Lancaster, we group them into 4 curriculum themes. So those curriculum themes just help sort of guide things and show you which areas they fall into. And it's also a way of grouping sort of lectures and resources. So the 4 themes we follow are the medical sciences, which you'd expect, and then what we call population health, which is your statistics, your epidemiology, things like that. Health, culture and society, which is essentially just medical psychology and sociology tied together. And then professional practice values and ethics, which as it sounds is the professionalism and ethics like we discussed. So from that, you've grouped the different bits of information you found, and then as a group, you decide what objectives you want to set to learn. So you pick out all the bits of information, and then you sift through and you sort them, and you come up with your objectives. Now, there's always a member of staff there to guide you, so they'll make sure that you don't get any objectives that are completely wrong, and they'll make sure that you get all the objectives that you need to. So once you've got those objectives, you then go away and do your self-study. Now, this is where people like to go off and vary it, and different people will do different things for their self-study. Some people like to go off and work in groups. I'd always study with several of my friends, so that that's just how I like to work. And it gives you that opportunity to figure out how you study, how you actually learn, and what works for you, and find things that work. For me personally, I know that anatomy, I could not learn it through looking at pictures just blankly or through lectures. Someone's reading out a bunch of labels to me, it meant nothing. I could not learn it like that. So for me, I found that flashcards and an anatomy colouring book were the most useful ways for me to learn anatomy. And that the fact that you've got the free time to self-study in the PBL allows you to do that. It allows you to go off and think that this is what works for me, I'll do that. And if it's areas that you particularly struggle on, then that's fine. You can decide to dedicate more time to that. Whereas if you were in a traditional course, you can't decide that you're going to have more lectures on something. Whereas in PBL, you can decide that you spend more time going through something, that you find extra resources on it. So once you've gone away and done that self-study, I should have said this, the discussion and the reading through and the setting your objectives is done in 1 2-hour session. Then you go off and do your self-study for a week and a half, and then you have 2 feedback sessions, which are again another 2-hour sessions, and you go through and you discuss, everyone feeds back what they've learned, everyone discusses it, and if it's an area that you've particularly struggled on, then you might ask a few questions yourself, and other people will be able to explain that to you. And then you'll also might be able to explain things to some other people, which then reinforces your knowledge, because it's one thing knowing something, but being able to explain it and verbalize that information, it means it sticks with you a lot more and it provides you those skills. So this is all done, like I said, in small groups with a trained member of staff there. So it really facilitates it. You get other things alongside that, which I'll come on to discussing in a minute. And the PBL process is it's very commonly used. It's used in sort of a lot of different medical schools across the UK and globally. It originated in Canada in the 1960s as a form of sort of medical education. And I've spoken to doctors who trained abroad. I remember speaking to doctors who trained in Pakistan, and they'd learn like that. So it is a very widely used process. So next, what we've got here is a scenario that I've come up with. So this is a very much a slimmed down, quite basic version of a scenario. This is more like a second year scenario, because like I said, we don't learn we only learn about the normal anatomy and physiology in first year. So I'll just give people a bit of time to read that through. And if anyone's got any issues seeing that on the screen, I'm happy to read it out if people would want that. But if just say in the chat if anyone needs it reading. And if people want to start posting in the chat which things that they think might be key that you might want to pick out, there's no right or wrong answers. You could pick out a lot of different things from this scenario, and then I can go through the things that I would pick out from it. Anyone wants to be brave and post in the chat what things I think you might want to pick out from that to develop an objective from. I'll give people another minute and then I'll start sort of going through. Yeah, so yeah, definitely the COPD, current medical conditions. Fever and dry cough, yeah, that'd be symptoms. So we might want to discuss what the symptoms they could be of. So yeah, definitely the anxious there. And you can always pick up a few little clues from the title of the scenario. So this one is breathless and anxious, so it would lead you to think that you're discussing those sort of things. Yeah, so yeah, definitely symptoms of COVID. So that would be something that from this we'd want to pick up on. So she could be isolated potentially. So I'll start going through sort of line by line. So the first line, she has a history of COPD. So that's something we might want to pick up on. She's usually only breathless on exertion, so that would be sort of a symptom that we could look at, and it also shows from on the later stage of our training sort of what level of disease she has. So the fact that she's only breathless on exertion would suggest that she's normally quite well. She's now developed a fever and dry cough. So the fever and dry cough, like you picked out, would be concerning features there. They'd be symptoms of something. And she's becoming increasingly short of breath at rest. So if someone's short of breath at rest, that's quite concerning because that's showing that their body's working really hard. And then if we go along to the line below that, she's worried she's developed COVID-19. So she could quite possibly have COVID-19, but she could quite possibly have anxiety. In this, we don't actually know. We never get the end of it. Normally in a PBL scenario, it's normally about a side of A4. This is obviously a lot shorter than that, but it's just sort of illustrate how these things work. So then going through into the second paragraph, they've reviewed current government policy. That might be, you could potentially have to look at what the current government policy is. And then health promotion, health protection activities. Now that's quite a loaded phrase. And quite often in PBL scenarios, there will be lines like that it's just quite an obvious one to people who are experienced of it, that's what you'd want to be picking up on. And then he speaks to an interim who's graduated early, and then they discuss how she's finding it, and then being rushed into work, and competencies working as a clinician. So again, competencies working as a clinician is quite a specific phrase, and that would then lead you to think, what are they wanting us to get out there? And that might be something that you as a group have a discussion over, and then you come up to see if you think that might be an objective. There could be things in here that aren't necessarily objectives, and then there could be things that if the things that aren't necessarily objectives that you as a group pick out, that's fine, because the tutor who's there will be able to tell you, actually, no, you don't need to spend time doing that part. And then we've got the psychological impact of living with a long-term health condition in normal life and during a pandemic. So like a lot of you picked up, the psychological aspects. Now that could be from a mental health perspective. We might be learning about mental health and how we manage that, or it could be from a psychology perspective, and that could come into the health, culture and society aspects of our course. So here I've highlighted out sort of the bits that I'd pick out as the most key ones. Now I did write this scenario, so it is very much what I was anyway. So I've grouped them into different colours. So the red is what I would class as sort of the medical sciencey ones. So they're the ones that I really want you to go away and read your medical textbooks. But the other ones are different. So the one that I've highlighted in the darker blue, I'd put that for more of a a population health aspect and looking at that. And those are two specific phrases which you need to know sort of definitions and examples of as a medical student. And then competencies as a clinician, that I've highlighted in purple or pink, depending on how it comes up on your screen. And to me, that is more of a professional practice one. It's getting at what do you need to do to be competent. And then the psychological impact of living with a long-term health condition, that's almost an objective in itself. Now I'll come on to the slide where I've got the objectives. So there we've got what you sort of expected, the defining the COPD, discussing it. So there's different things there about its features, management, prognosis, and they're the sort of things that you'd want to pick up on. Now, it doesn't explicitly say them in the scenario, and that's just something that you get from experience of doing PBL. And then outline clinical features consistent with COVID-19. See, we saw a few features listed there, and we saw that there was a discussion of COVID-19. So that's something that we'd then pick out. And then indications for testing investigation. That's something that you could pick out from the scenario, or it might be a more trickier one. And that's where you might have questions being asked of you, saying, how would you know? And that's where your tutor would come in guiding you. They'd ask, how do you know who needs testing? Or they might guide you in that way. Then we come on to the different aspects. So like I said, just defining health promotion, health protection, and providing examples. That's quite a straightforward one. You can go and look that up quite quickly. And then health, culture and society, discuss the psychological impact of living with a long-term health condition. So normally for an objective like that, we would be given recommended resources. We always get a recommended resource list that in theory covers all the objectives, but for those in particular ones, there'd probably be some quite particular resources that we could go and look at. So it guides you quite straightforwardly. And then reviewing the importance of individual clinicians, making sure they're clinically competent and working within GMC guidance. Again, there's probably a specific bit of guidance that they'd want you to read for that. And that's something that as a group, you then come back and discuss. So I've hinted there as well at sort of what other teaching do we get. Now, we'll just have the caveat that this is mainly focused on first year. And this is sort of what you'd get in first year. In second year, you'd still get all of these aspects. But in second year, instead of it being spread across the 5 days of the week like it is in first year, you have 2 days a week of clinical placement. So what would have been across 5 days is condensed down into 2 on the Mondays and the Fridays. You'd be at university getting these things. So you've got a lot less free time in second year, and that's just the reality of it. In years 3 and 4, there is still the PBL there, but it's more closely linked to sort of what rotations you're on, or it's delivered as sort of clinical placement rotations or specific teaching days or teaching weeks. So it's a bit different and it's a bit more tailored to those years. And it's quite hard to sort of explain it all succinctly, because obviously it's not the easiest thing to discuss a 5-year degree in a 45-minute session. But so this is what it's like for mainly first and second year. So in every PBL module, every PBL session, there's always a trained supervisor who covers and guides the group. But in every PBL module, we get other teaching. So there's always lectures, so roughly 10 lectures per 2-week module. So there's still teaching there, and those lectures are there to guide you. They'll sort of show you which areas you need to cover. If there's a particularly challenging aspect of that module, then they'll focus on that so that that students know it. So there's a lot of guidance there, and they help show you what you need to learn and how much. They also get anatomy workshops every single week in first year. They're a couple of hours long, and they go through some of the specific parts of anatomy step by step and draw it out with you. And then they also do sort of digital microscope, and there's a large emphasis on using imaging and radiology. So we get a lot of radiology teaching, because as doctors in the modern world, we need to understand how to interpret a chest X-ray. We need to understand what when we're looking at scans, what we're looking at, how they all work, and part of that is through the teaching that we get, and part of that is through clinical placement. And I think the earlier you get the teaching of how to look at an X-ray, the more you're going to get out of the placement when you're looking at them. We also get clinical skills workshops every week. So the clinical skills workshops normally tie into the module. So if we're learning about the heart in that module, then we tend to get taught the cardiovascular exam, things like that. They don't always marry up perfectly, but they're normally roughly similar. And those modules are delivered in a simulated ward by trained clinical skills teachers, and they go through it all with you as groups, step by step, and you get the opportunity to learn and practice that on each other in first year, so that at the end of first year, when you sit your clinical exam, you can show that you're competent, and then you can go away happy knowing that you know what you're doing. So when you go on the wards in second year, the medical school can be sure that you know what you're doing, and you can feel confident going there and practicing those skills on real patients, because there's a big difference between doing it on each other to start with and then going and doing it on patients who've actually got things wrong with them. And then you also get lots of other workshops, study skills modules, and communication skills spread out throughout first year to just develop your all-round skills and help you progress. And some of those will, again, cover aspects that you might not know about. So one thing that a lot of people are often anxious about and ask about PBL is, how do we make sure that we meet the curriculum? And there are a lot of different ways, and I've touched on that a lot, but the PBL tutors are really, really useful. They're experienced members of staff who know what they're doing, they know how the PBL works, and they know what you need to cover, and they're there really to guide you. I'm not saying that it's not really scary, and I'm not saying that the first module when we all started, we didn't all panic and think, God, I've just got a list of things. I've got to learn all the bones. I've got to learn all the GI tract. I've got to learn this. I've got to learn that. And it's a shock to your system at first, and it's something that you have to get used to, and you just get used to it. And it's something that you develop over time. You get used to doing the PBL. You get used to working through things, and it's all just about time and practice. And like I say, we get lectures and workshops which are there to really guide you. They don't teach you everything. They don't intend to do that, but they guide you to showing you what you do need to learn. We have mock exams, so roughly sort of January, we'll have our mock exams, and they're just there to show us what the structure of the exams will be like, what the sort of content will be, and they're a really good guide to thinking, right, in the next half of the year, what do I need to learn to sort of meet those type of questions? We have feedback sessions. So in the PBL, like I said, we have feedback sessions. So if you don't know something, or you've missed something out and not realised that you've done it and everyone else has done it, then you know, oh, everyone else in the group's learned this, I didn't learn this, I better go away and learn it. So that's a really good way. If 8 of you have gone away independently and studied and come back, and you'll have found most things are relevant, it'd be quite hard not to. And then, like I say, time on placement. Yeah, we get placement early and you don't know as much, but then the things that you see on placement, personally, I would go away and learn about them, because that's the way I work. I'm quite inquisitive. I like doing that. That doesn't work for everyone. So you'll see patients with common conditions in hospital, because the most common things are the ones that are on the wards. So you see them, you go away and learn them, and it drives you learning towards the things that are common. Now this slide, it's quite a sort of specific slide. So who is suited to PBL? And that would be something, if you're thinking of applying to medical schools, you're thinking of applying to potentially PBL medical schools, am I right for it? And that's something that you need to decide for yourself, really. I'd say the sort of people who it works for are sort of self-motivated. If you're someone who's quite keen to just get on and do it yourself, then it really, really works. I'd say that's the sort of person I am. I quite like just going off and doing things. I quite happy to work independently. I like working with other people. So PBL offers you that. It offers you the opportunity to go away and work on your own and study and figure out things on your own, and then come back and discuss it with the group. And there's no one saying how you should go off and do your independent study. So if you want to do that as part of a large group, then you go ahead and do it. And it can be really, really useful for some people. You can gain a lot of skills from it. You get used to working in a team. You get used to communicating complex ideas to the group. Within the sessions, we also have someone who's a designated leader for that session. So it offers some people the opportunity to develop their leadership skills, feel more confident about speaking and build up on their confidence, and just develop their independent study skills and sort of proactive problem solving. Because if you approach every scenario, you don't know anything about it, then you go away and learn about that. When you're a doctor, you come up to a patient who you don't know about their condition, then you are used to going away and learning about something. So it teaches you those skills of going off and proactively studying. And personally, for me, I couldn't have done a lecture-based course. I couldn't think of anything worse. I don't have the attention span or interest for it, and I just can't take information in through lectures for that long. So it offers an alternative. If you're someone who hates just sitting there and being lectured at all day at school, there may be something like PBL where you get to go off and do it yourself and work through things as you want to, might really suit you. So a bit about life outside of medical schools. I feel like this is something that's often not really touched upon, and what we sort of get to do as medical students and what the university is like. I'd say sort of get as much information as possible from university prospectuses, websites, digital open days this year, I'm afraid, and just try and choose universities that suit you. I'd say for medicine, you only get the 4 choices, and if you only get one offer, you can't really afford to turn that down. If you actually decide, I really don't want to live in whatever city, you need to choose 4 universities that you'd be happy to apply to, that you'd be happy to study the way they study. So I'd say if you think that PBL is not for you, then please don't apply to a PBL university. You'll have a miserable 5 years. But at the same time, if you think, yeah, that sounds great, then do it. It's really up to you. And then sort of choose universities that suit you. Like I said, the location, living costs, things like that. There's a whole lot more to it. And then you've got in medicine, there's often a sort of impression that you should be studying all the time. And especially with PBL, it's quite easy for you to go off and spend 50 hours doing independent study in the week and just obsessing over it and not having free time. And I'd say that a key thing to remember with the PBL is remembering to take your independent time, working independently, but also have time for yourself. You need that work-life balance. And having PBL and having the free time allows you to develop that work-life balance and figure it out for yourself. So that is everything that I've really got to say. So if people have got any questions about anything to do with Lancaster, to do with PBL, please feel free to bob them in the chat. What are the entry requirements? So if that's quite a specific question. So if you go over to the expo, Lancaster have got a stand and there are staff members there who can answer what the specific entry requirements are. What's the student life like at Lancaster? So Lancaster is quite a small town. Well, it's a city. It's quite a small city generally, and that makes quite a close-knit student community. It's a very safe town. It's very nice. It's very scenic. You're just on the foothills of the Lake District, so you can, on a clear day, you can see the hills of the lakes, which is lovely. You're just next to Morecambe Bay, which is beautiful, beautiful area. So it's a really nice part of the world, and most students enjoy it. Lancaster rates very highly. It's very nice accommodation. It's a collegiate university, so it's broken down into 9 colleges, 8 undergraduate colleges, and that really fosters a strong sense of community. There's a lot of social activities. There's a lot of sporting activities. So it's a fun place to be. I've really enjoyed my 4 years at Lancaster. Like I said, I'm on the MedSoc exec. The MedSoc, we do a lot of events. We do balls. We do socials. We do non-alcoholic socials. So we do meet and greets, pancake mornings. There's loads of different things. And because Lancaster is a relatively small medical school, we have a intake of 129. It's relatively small, so you get to know people. You get to know the majority of people in your year. You get to know people in years above you, years below you. Some of my best friends are in 2nd and 3rd year, because you get to know people, and that's really nice. And they can help you. You can help them. So it really benefits people. How many places are for international? So there are 4 international places at Lancaster, so it's quite competitive for international. Do we have a BMAT threshold? So Lancaster don't have a set BMAT threshold. What happens with Lancaster is that they rank everyone based on the BMAT. But if you look and then they draw a line above a certain number. If you look on their website, they'll be able to tell you what the BMAT threshold is for every year. I don't have the link to hand, but if you go to the expo stand, Ellie over there will be able to send you the link to see what the BMAT thresholds were on the website. Are there many graduates on the undergraduate course at Lancaster? Yeah, there are loads. In my year, they make up about 20%. Other years, it's going to be more. I lived with 2 graduates in a 4-person house. Yeah, there are loads of graduates on the undergraduate course. They'll find that it works quite well. They're all quite happy. How is clinical placement? So, like I said, we do a lot of clinical placement at Lancaster. So you get a few days in first year, which are really useful, just sort of dip your toe in the water, get a taster alongside your clinical skills teaching. But then in second year, you get in 2 days a week in hospital, on the wards, seeing patients, and that's done. You're always in a partner. So you're never on your own, and there's clinical skills nurses there who are there to guide you. They'll go through the skills with you. So it's really useful to get that time, because you're never ever going to have that amount of free time to learn on the wards again as we have in second year. So you get to speak to as many patients as you want, examine them, practice doing things, take histories, present those cases. And it's really, really useful for us. And then when you get into third year, you then do specialist placements. So you'll do community mental health, you'll do care of the elderly, neurology, things like that. So that gives you the opportunity, when you've got those initial skills, sort of general skills in first year, to then develop those skills further into the second and third year, and they all build together. And then fourth year, you sort of have a general placement like second year plus a specialist placement like third year together. So you revisit everything again and further refine those skills. So I hope that makes enough sense about how the clinical placement is. And then in fifth year, it's done in apprenticeship style. So you're there working on the wards, preparing yourself to be a foundation doctor when you graduate. How long are the PBL sessions, and how many are there per week? So for PBL sessions, in the 2-week module, there'll be 3 sessions. So there'll be one on the Monday of the first week, and that's 2 hours, and that's objective setting. And then in the second week, there is another 2-hour session. There's another 2 2-hour sessions, one on the Monday, one on the Friday, where you all feed back how long what you've learned. So also, how many hours is expected to do self-study for the sessions approximately? It really varies depending on the people. I honestly can't remember what set number they recommend. If you go over to the expo stand, I know Ellie over there will be able to give you a really specific number that they sort of recommend. But if I'd say sort of treat it like a 9-to-5 job, and that works for most people. Do you have the opportunity to intercalate, and also do you have an elective at Lancaster? So yeah, you definitely have the opportunity to intercalate. So I'm going to be intercalating next year in urgent and emergency care. So I'm taking a year away from Lancaster. Lancaster is really, at the minute, really, really open with intercalating. So in my experience of it, there's been no restrictions on who can intercalate. Some medical schools impose restrictions on you have to be in certain decile groups or certain parts of the year. There's no restrictions on that. Lancaster are happy for everyone in our year to intercalate if they wanted to. So the opportunity's there. They have no restrictions on you staying at Lancaster or going anywhere else. So I'm going to Plymouth. People can go wherever. So Lancaster are really, really good at facilitating the intercalation. Do you have an elective? So yeah, at Lancaster, you do a 4 or 5 week elective after you sit your finals. So we sit our finals at the end of fourth year, and then we go off and do our electives. Mine this year was sadly cancelled because of the pandemic, but normally you go off and have a 4 or 5 week elective. So an elective that Jacob's asked is a placement that you can pick, that you have to do, but it's a part of the course, and you can pick whatever specialty anywhere in the world. You have to arrange it and fund it yourself, but you can go to Australia, Guatemala, America, wherever you want, or you can stay at home. I was planning on doing mine at my local hospital back home. It's really up to you. There are bursaries available from different places, so you can afford to go to different places. But it's an opportunity for you to explore something and do something different. And a lot of people treat them as sort of an opportunity to go on holiday to places that they wouldn't necessarily get to go. Our tuition fees for fifth year covered by the NHS. Currently, the NHS bursary does cover the fees for fifth year and for intercalation on a undergraduate intercalation. But there's always a chance that could change. So you'd have to check with the NHS about what any potential changes to that. But yeah, Lancaster does currently get covered in that. What's the day-to-day life like at Lancaster? So it really varies, but Lancaster's a nice place. There's plenty of things to do. There's lots of bars, clubs, pubs, restaurants. The university's got, each college has its own bar, so there's 9 bars on campus. But there's lots of cafes, and it's quite a vibrant place, especially during term time. There's lots of people there. Outside of term time, it's a lot quieter because there aren't all the thousands of students filling the town and filling the campus. But it's quite a nice place. I thoroughly enjoyed my time, and all my friends love being in Lancaster. Like I said, it's an incredibly safe city, which I think is a really big selling point of it to a lot of people. You feel comfortable, you feel safe. It's a really nice sort of home from home. Are there lessons during the elective? That really depends on where and who you arrange your elective with. You completely arrange all that yourself. So some places will have taught sessions during their electives, some places won't. It really depends on how you arrange it. I'm happy to sort of go over any of that if people have got any more questions or anything that I've answered that they think they'd like clarifying more, or anything to do with sort of Lancaster or PBL. Like I say, there's a group of us over on the expo stand, so feel free to head over there and ask any more questions. So the elective, it's 4 or 5 weeks, and yeah, you pay the costs of that elective. So you pay the tuition fees for your year at medical school, so it's just on the end of 1 year. And then the elective you fund yourself. Like I said, there are bursaries available from different places, but yeah, it's something that you fund yourself, if that makes sense. Great.
Thanks very much, Harry. There's like 2 minutes left before we're supposed to go to change over anyway.
Yeah,
so if you want to take
fine.
like two or three more questions and then wrap up.
Yeah. So which part of the application does Lancaster Uni prioritise? So there's not a prioritisation. So it's a 4-stage approach. So the first is the sort of academics. So looking at your GCSEs and predicted A levels. Then you look at BMAT as the second stage. Then third stage is interview, and then fourth stage is sort of fitness to practice. So it's the different stages that you go through. No one stage is prioritised over the other. They go through step by step. So you have to sort of meet the minimum at each stage to continue on to the next stage, if that makes sense. If you want to go over to the expo stand, the members of the admissions team there, he'll be able to give you the sort of precise information and links to it.